patient assess their risk? How do doctors assess risk for
Correct.
patients?
So for assessment and the risk stratification, we get their test done.
Like what kind
Once
of tests?
now these are all basic tests like
Like a ECG.
ECG, echocardiography, treadmill test, and coronary calcium score. So these are the basic non-invasive tests for diabetic individual. If at all some of the test is showing some sort of signaling which can lead to heart problem, or which can you are becoming at a high risk of development of heart disease, then we subject them to undergo coronary angiography. And once the angiography is being done, we know that which are the lesions, which are the blocks, which are responsible for producing life-threatening condition. We need to treat those conditions. If at all it is producing a diffuse disease or a small vessel disease and multiple plaques, it can be managed conservatively or medically as well.
Okay.
And if there are blockages which are there in almost all the arteries and they are affecting mainly the proximal part, that means the earlier part of the artery, then it might lead to even bypass surgery as well. So it all depends on what exactly is the angiography picture tells you.
What about CRP levels?
Yes.
What exactly are
So
what
very
is
important.
CRP?
Yes, very important question. CRP is basically C-reactive protein. It's an inflammatory marker.
Okay.
Now this CRP came into play along with D-dimer during COVID days. Like everyone was getting CRP. It is basically suggesting that whether you are having any sort of inflammatory condition in the body or not. Now for heart, CRP is not important. For heart, HSCRP is more important.
Which is what?
Which is high sensitive C-reactive protein.
Okay.
HS stands for high sensitive.
Okay.
What it does, it will give you the idea about the presence of inflammation within the coronary artery. That means the arteries are being affected by first by cholesterol plaque and second by inflammation.
Swelling.
So by layman language, it is just a swelling. Now that swelling, if the level is remaining between 2 to 5, that shows a presence of swelling within the coronary arteries. But if it is more than 10, you have to think about more causes except heart disease.
So you're telling
when
me
it
that the
is
heart can
very high,
swell when there is no heart
so
disease.
here we are not talking about heart as a structure
I'm
is
talking
getting
about- sorry,
the
the artery.
coronary artery.
Yeah.
The arteries is getting swollen.
Okay.
So if it is the range is between 2 to 5, it is mainly involving heart or coronary arteries. But if it is more than 10, 10 is a gray zone, which can be because of some other inflammatory conditions. Say for example, you have a rheumatoid arthritis. You have some collagen disorder or some SLE or something like that, which is involving the chronic inflammatory condition. That can also lead to high CRP level.